grade 9 students. Welcome to Bamboo Telescuela. This is your school on air in Science 9. I am Teacher Joy Anita Losig from Kawayan City National High School, Maine. Now, set your mind as we journey the fun and a whole new adventure of science. Make sure to have your module, pen, and science notebook. Go to a comfortable place and prepare yourself to listen for today. As you tune into DWDYAM, CMD Cable Vision, and also streaming live at SDO Kawayan Facebook page. Physical fitness is not the sole basis of being healthy. Being healthy means mentally and emotionally fit. Let's watch this video.
It's important to remember our physical health affects our mental health and vice versa. What we do to our bodies makes a big difference to how we feel. Physical activity, diet, alcohol, smoking and drugs can all affect our mental health and well-being in different ways.
Being healthy should be part of your overall lifestyle. Feeling good about yourself and taking care of your health are important for your self-image and self-esteem. Maintain a healthy lifestyle by doing what is right for your body. Our topic for today is all about how one's lifestyle can affect the functioning of the respiratory and circulatory system. This is just a continuation of our last week's discussion. It is important that at the end of this lesson, you, my dear students, should be able to first, identify the healthy habits to help the respiratory and circulatory system healthy. Second, practice good health habits to keep the respiratory and circulatory system healthy. Let's find out as we journey in this module and discover that practicing good healthy habits can help the respiratory and circulatory system healthy, since we all know that health is wealth. Taking control of one's health and practicing good healthy habits will determine a healthy future. Let's watch this video.
From the minute we're born, we're aging. Constant exposure to our environment, the things we eat, and stresses from both inside and outside our bodies all cause us to age over time. Aging is highly complex, but scientists are starting to understand what happens at the cellular and molecular levels. For example, healthy cells are damaged over time when our immune systems shift from reacting to short-term problems like injuries and infections to gradually producing chronic inflammation throughout the body. Time also gradually shortens the telomeres that act as protective caps for our DNA-containing chromosomes. These and other changes make our bodies less and less able to deal with stresses from inside and outside of our body. So when damage reaches a critical level, our cells, tissues, and organs may no longer perform normally, and our health starts to decline. The changes associated with aging start to happen on some level at day 1. We begin to experience their effects early in life. For example, we lose the ability to hear certain high-frequency sounds as teenagers. Our cognition and memory slowly decline after they peak in our mid-20s. The strength of our bones starts to decrease in our 30s. Female fertility sharply declines after 35. Age-related nearsightedness begins in our mid-40s. And our hair starts to gray and thin as early as our 30s and 40s. After the age of 50, the changes of aging become increasingly noticeable. And because aging is the biggest risk factor for most of the diseases that affect us as adults, the older we get, the higher our risk of chronic disease becomes.
A healthy diet and regular exercise are important in maintaining a healthy lifestyle. But other factors like one's ability to deal with stress, getting the correct number of hours of sleep, avoid smoking, and drinking responsibly are also part of the equation.
Most of us can be healthy and active well into our later years if we take care of ourselves. It's no surprise that regular physical activity can help maintain a healthy weight, improve moods and sleep habits, and boost overall health. And it's clear that a well-balanced diet full of nutritious foods is critical to good health.
I hope you are now ready for the lesson. But first, let's have a rundown of the points we discussed in our previous lesson. We talk about cigarette smoking, which harms nearly every organ in the body, causing many illnesses and affecting health in general. Cigarette smoking has great effect to our systems, most especially to our respiratory and circulatory systems. The negative effects of cigarette smoking on circulatory system includes increased heart rate and blood pressure, coronary heart disease, and arteriosclerosis. The respiratory diseases caused by cigarette smoking are chronic bronchitis, emphysema, asthma, cough, colds, tuberculosis, lung cancer, and other respiratory diseases. This time, let's focus on how can we take care of our respiratory and circulatory system by practicing good healthy habits. Let's start with the respiratory system. How can we take care of the respiratory system to prevent the ailments that affect the respiratory organs? The respiratory system is the system that helps you breathe. Taking care of your lungs today, and you are more likely to breathe easier in the years to come. Some respiratory problems are easily treated if they are properly diagnosed, and many are preventable. The most important factors relating to respiratory health problems other than genetics and family history are smoking, obesity, and air pollution. Smoking can lead to a variety of ongoing complications in the body, as well as long-term effects on your body systems. While smoking can increase your risk of a variety of problems over several years, some of the bodily effects are immediate. In addition, people who smoke are at higher risk of respiratory infections, and there is a growing evidence that this includes coronavirus or COVID-19. The lungs are different from most of the other organs in the body because their delicate tissues are directly connected to the outside environment. Anything you breathe in can affect them, including germs, tobacco smoke, and harmful substances like dust and chemicals. Here are some guidelines to keep our respiratory system efficiently functioning and to maintain our body's overall wellness. First, clean, fresh air is vital in keeping our respiratory system healthy. Avoid places with high levels of air pollution. Stay away from smoke-belching motor vehicles and strong factory fumes. Cover your nose and wear a protective mask when you go outside, especially if you are allergic or have asthma. Let's watch this video.
A fabric mask acts as a barrier to prevent the spread of the virus. It must be used correctly and always combined with other measures to protect yourself and everyone else. When wearing a fabric mask, clean your hands before putting it on. Inspect the mask and do not use it if it is damaged or dirty. Cover your mouth, nose, and chin. Adjust the mask to your face, leaving no gaps on the sides. Avoid touching the mask while wearing it. Change your mask once it gets dirty or wet. To take off the mask, clean your hands first. Remove it by the straps behind the head or ears without touching the front of the mask. As you remove the mask, pull it away from your face. Clean your hands after taking off any mask. If you need to reuse a fabric mask, store it in a clean, resealable bag. Hold the mask at the elastic ends when removing it from the bag, and make sure it is not dirty or wet before using it again. Wash fabric masks in soap or detergent, preferably with hot water, at least once a day. Make sure you have your own mask and do not share it with others. When wearing a mask, make sure you know how to put it on, use it, remove it, and discard it or wash it correctly. Remember that a mask alone cannot protect you. When wearing a mask, continue to adopt other measures to prevent the spread of the virus. Stay at least 1 meter away from others. Clean your hands frequently and thoroughly, and avoid touching your face and mask. Stay safe, and let's all prevent the spread of COVID-19.
Number 2. Maintain clean, dust-free surroundings at home. Exposure to undisturbed dust and mites can weaken your lungs and may trigger asthma and allergic reactions. Minimize the use of aerosols or air fresheners and pesticides. Number 3. Quit smoking or never smoke at all. Smoking is a major cause of lung cancer. Being a non-smoker is not enough. Avoid passive smoking. Carcinogen in a cigarette and tobacco causes abnormal and rapid growth of cancer cells. Fourth, stay away from people who are infected with cold, bronchitis, and tuberculosis. These respiratory diseases are contagious. Fifth, do regular exercise. Simple breathing exercises and taking a brisk walk regularly will strengthen your lungs and promote overall wellness. Next, have enough rest, eat a healthy diet, and get extra medication. Multivitamins can help strengthen your immune system. Lastly, seek immediate medical treatment at the first sign of respiratory infection. When cured early enough, respiratory infection will not develop into serious complications. Educating yourself and your loved ones about the respiratory health is key to maintaining a healthy lungs. Breathing is required for life, but often taken for granted. Knowing the many ways that a person can take care of the lungs is key to prevention of diseases and easy breathing for years to come, as well as ensuring quality of life for future years. Next is the circulatory system. The circulatory system is the body's transport system. The circulatory system transports blood and other materials through our body. Everyone is at risk of heart disease, but you are at higher risk for heart disease if you have high cholesterol or high blood pressure, smoke, are overweight or obese, don't get enough physical activity, or don't eat a healthy diet. Your age and family history also affect your risk of heart disease. Your risk is higher if you are a woman over age 55. You are a man over age 45. Your father or brother had heart disease before age 55. Your mother or sister had heart disease before age 65. But the good news is There's a lot you can do to prevent heart disease. If you're at risk for a circulatory system disease, work with your doctor to control conditions such as high blood pressure, high cholesterol, and diabetes. You can also take steps and make lifestyle changes to prevent these conditions. Here are some guidelines to keep our circulatory system efficiently functioning and to maintain our body's overall wellness. If you exercise for 30 minutes or more, your weight will be reduced and you will reduce the risk of developing other conditions that make your circulatory system work harder, like the high blood pressure, diabetes, and high cholesterol. Let's watch this video.
Regular physical activity can lower your risk of heart and circulatory disease by 35%. When you are active, the heat produced by your muscles increases your body temperature, making you feel warmer. Your heart starts to beat faster, pumping more blood to the muscles you are using. Your heart is also a muscle. If you are active regularly, it gets bigger and stronger. Your muscles are working harder, so they need more oxygen. You start to breathe faster so your blood can pick up more oxygen from your lungs. Your lungs work harder to make this happen. Once your blood has picked up oxygen, it moves to the muscles you are using, giving them the extra oxygen they need. If you are active regularly, more capillaries grow in the muscles you've been working. This is one reason why activity starts to feel easier over time. Getting active is great for people with diabetes. If you have type 2 diabetes, you have too much glucose in your blood, probably because you don't have enough insulin. Physical activity helps you use the insulin you do have. It also helps your cells use glucose, even when there is no insulin. Regular physical activity can improve your memory and attention span. Over time, the bit of the brain involved in memory and learning seems to get bigger. Long-term physical activity leads to a lower resting heart rate and lower blood pressure. This helps cut your risk of heart and circulatory disease. And there are more reasons to smile. When you're active, your brain produces chemicals called endorphins. These reduce feelings of pain and make you feel more positive. Getting active cuts down on stress hormones, reducing anxiety. Combine activity with a balanced diet and you'll help yourself reach and maintain a healthy weight. Aim for 150 minutes of moderate intensity activity per week. Try to be active every day. Every 10 minutes counts.
You should eat healthy and balanced food that is low in fat and salt. If you eat high-quality food, your food will improve the health of your circulatory system and the heart. You should avoid the food which has high saturated and trans fats. You must avoid alcohol consumption to keep your circulatory system healthy. Let's watch this video.
There are numerous types of fat. Two types, trans fat and saturated fat, are considered to be generally unhealthy because they appear to play a role in cardiovascular disease. Saturated fat. Saturated fat comes mainly from animal food sources like red meat, chicken and turkey, and full-fat dairy products. Eating a lot of saturated fat increases your levels of low-density lipoprotein, or LDL cholesterol, which raises your risk of experiencing a heart attack or stroke. Trans fat. Trans fat is different from saturated fat because it comes from oils that occur due to a food processing method called hydrogenation. Hydrogenated or partially hydrogenated trans fats raise your level of LDL cholesterol and triglycerides, which is bad for heart health. Trans fats also lower high-density lipoproteins, or HDL, which is the so-called good cholesterol. Saturated fats are solid at room temperature, like a stick of butter. Trans fats are semi-solid at room temperature. Trans fats are commonly found in baked goods, fried fast foods, potato chips, and frozen pizza.
You should eat more fresh and clean vegetables and fruits that rich in iron to avoid the infection with the anemia disease. You should drink a suitable amount of clean water every day, especially in the summer. You should avoid exposure to the infections and the accidents. And when you are wounded, try to stop the bleeding. Clean the wound and treat it. You should avoid smoking and smokers, where smoking harms the heart and weakens the blood circulation. Smoking and tobacco products increase your risk for heart disease and may lead to the heart attack. You should maintain a healthy weight, as being overweight can increase the risk of high pressure, diabetes, and high cholesterol and may lead to the heart attack. Let's watch this video.
Approximately 7 million people around the world die from heart attacks every year. And cardiovascular disease, which causes heart attacks and other problems like strokes, is the world's leading killer. So what causes a heart attack? Like all muscles, the heart needs oxygen, and during a heart attack, it can't get enough. Fatty deposits, or plaques, develop on the walls of our coronary arteries. Those are the vessels that supply oxygenated blood to the heart. These plaques grow as we age, sometimes getting chunky, hardened, or inflamed. Eventually, the plaques can turn into blockages. If one of the plaques ruptures or cracks, a blood clot will form around it in minutes, and a partially closed artery can become completely blocked. Blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes. This is a myocardial infarction, or heart attack. Things can rapidly deteriorate in the absence of treatment. The injured muscle may not be able to pump blood as well, and its rhythm might be thrown off. In the worst-case scenario, a heart attack can cause sudden death. And how do you know that someone is having a heart attack? The most common symptom is chest pain caused by the oxygen-deprived heart muscle. Patients describe it as crushing or vice-like. It can radiate to the left arm, jaw, back, or abdomen. But it's not always as sudden and dramatic as it is in the movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and the elderly. For them, weakness and tiredness may be the main signal. And surprisingly, in many people, especially those with diabetes, which affects the nerves that carry pain, a heart attack may be silent. If you think that someone might be having a heart attack, the most important thing is to respond quickly. If you have access to emergency medical services, call them. They're the fastest way to get to a hospital. Heart attack treatment is advancing, but prevention is vital. Genetics and lifestyle factors both affect your risk, and the good news is that you can change your lifestyle. Exercise, a healthy diet, and weight loss all lower the risk of heart attacks, whether you've had one before or not. Doctors recommend exercising a few times a week, doing both aerobic activity and strength training. A heart-healthy diet is low in sugar and saturated fats, which are both linked to heart disease. So what should you eat? Lots of fiber from vegetables, chicken and fish instead of red meat, whole grains, and nuts like walnuts and almonds all seem to be beneficial. A good diet and exercise plan can also keep your weight in a healthy range, which will lower your heart attack risk as well. And of course, medications can also help prevent heart attacks. Doctors often prescribe low-dose aspirin, for example, particularly for patients who've already had a heart attack and for those known to be at high risk. And drugs that help manage risk factors, like high blood pressure, cholesterol, and diabetes, will make heart attacks less likely too. Heart attacks may be common, but they don't have to be inevitable. A healthy diet, avoiding tobacco use, staying fit, and enjoying plenty of sleep and lots of laughter all go a long way in making sure your body's most important muscle keeps on beating.
If these health practices are not followed, what do you think will happen to the person involved? Now, let's have the rundown of the points to be remembered a while ago in the discussion. The best way to prevent the diseases in the respiratory and circulatory system is to have a healthy lifestyle, which includes a balanced diet, regular exercise, adequate rest, proper hygiene, stay away from stress, and avoiding vices such as smoking cigarette and alcohol drinking. Respiratory and circulatory diseases can easily be detected with regular health checkup and physical screening. Here are the tips to keep the circulatory system healthy. Maintain a healthy weight, don't smoke, exercise a minimum of 30 minutes a day, most days of the week, maintain a healthy, low-fat, low cholesterol diet with more fruits, vegetables, and whole grains. Avoid trans fats and saturated fats, which are often found in processed foods and fast food. Limit salt and alcohol intake. Use relaxation and self-care to reduce stress. Tips to keep the respiratory system healthy. Stop smoking and stay away from secondhand smoke. Avoid indoor and outdoor air pollution. Avoid exposure to people who have the flu or other viral infections. Exercise regularly. Eat a healthy, balanced diet. Maintain a healthy weight. And see your doctor for an annual physical checkup. Now that we are done with the discussion, I want you to go over your module and answer all the activities with the guidance of your parents or guardians. And don't forget to submit your module to your grade 9 science teacher. Very good! That wraps up our lesson. Congratulations! I hope you learned something new today. Just always have that mindset that science is fun. If you still have questions and clarifications, write it down on your module or message your science teacher. In addition, boxes are placed in your schools and other assigned places where you can drop your modules for checking. It has been a great day of learning and discovery that even COVID-19 cannot stop. See you again next time, here only on DWDYAM, CMD Cablevision, and follow the Facebook page of SDO Kawayan for more live updates and information. Remember that education must continue amid the crisis. This has been Teacher Joy and Ada Lasig for Bamboo Telescuela, bringing education in the comfort of your home. Be safe! Goodbye!